Today we're talking about breast cancer, and we have a dedicated breast oncologist, Dr. Ein-Gal, with us today to tell us a little bit more about it. Well, welcome. Thank you for being with us.
Thank you for having me.
So let's talk a little bit about what a dedicated breast oncologist is.
Yeah, sure. So a dedicated breast oncologist is an oncologist who dedicates his or her career to breast cancer only and all the treatments associated with that.
So you don't treat any other types of cancers, just the breast cancer?
That is correct.
Okay. Let's talk a little bit about some of the things that are available through Breastlink.
Yeah, Breastlink is a very unique, comprehensive breast center and has basically everything a woman would need, or a man. We do have men with breast cancer.
Right.
Everything a patient would need in order to achieve dedicated, comprehensive breast care. So starting from imaging, mammograms, ultrasounds, MRIs, through biopsies to make a diagnosis, breast surgeons, plastic surgeons, breast oncologists, and radiation oncologists. So really a comprehensive team to offer everything a patient would need.
So that way they don't have to go to any other facility?
Correct.
Okay.
That's correct.
And when does a breast oncologist actually come into play?
A breast oncologist comes into play after a diagnosis of breast cancer is made, be it via a biopsy or sometimes after breast surgery. And when anytime there's breast cancer, regardless of the type or stage, a breast dedicated oncologist would be involved in the treatment team.
Okay, so they wouldn't bring you in at the time of maybe looking at an image?
Depending really on the scenario. So we pride ourselves on having something called a Tumor board, where we discuss all new patients and review all the images, for example, and biopsies. And so sometimes a breast oncologist will be involved even before a full or complete diagnosis is established.
Okay. All right. Well, that's good to know. At least they bring in the necessary people.
Correct.
Okay. I know that there's an awful lot of different treatments that can be used for breast cancer, chemotherapy probably being one of the most popular ones, but I know there are others today. Which one would you recommend, or which ones do you see most often now?
Yeah, it's a really good question. I think every patient really gets a very personalized treatment plan. So it's the breast oncologist, one of our jobs is to decide what's the right plan for a patient. And a lot of factors play into that. The patient's diagnosis, the stage, the size of the cancer, the age of the patient, the other health issues a patient may have. And that all plays into our way of formulating a personalized treatment plan according to that. Chemotherapy is only one of potential treatments we have for breast cancer, and by no means the only one.
Right.
And there was a recent study that came out and was very much on the media, discussing that actually there are many postmenopausal women, about 70-75% postmenopausal women, that do not require chemotherapy.
Okay.
So we don't necessarily equate breast cancer with chemotherapy. Not all women are going to need chemotherapy.
So what are some of the other treatments that can be used?
So there are several other treatments, and it ranges from local treatments, for example, surgery and radiation treatment, and then whole body treatments. And we categorize those into two main modalities, one being, for example, chemotherapy, and another modality is anti-estrogen therapies, because the majority of breast cancers are actually estrogen driven.
Okay. Oh, okay. All right. And then I think I had read that precision medicine is coming along now these days, where you can really sort of pinpoint exactly what kind of breast cancer they have, which will allow you to, like you said, really have a specific treatment.
That's right. So today breast cancer treatments are sophisticated to the point where we first categorize what type of breast cancer we're dealing with, because there's several types. And I happened to see the book John Link wrote, and I helped with called the Breast Cancer Survival Manual. And in that book, we do explain very systematically how the breast cancers are divided into distinct subtypes, and each chapter is devoted into the distinct subtypes, and then really goes into personalized treatment based on that subtype and other characteristics. So it's absolutely true. The field of cancer in general, and definitely breast cancer, is going into very much personalized treatment plans. And again, that's the role of the breast oncologist to formulate and oversee that plan.
So as an oncologist, and now with some of these new technologies that are coming forth, or even like you said, the personalized medicine, is there training that you have to go back to, or is this just something that you learn about as you go along with your work?
It's a really good question. There's always training. So every day at work is a day of training. And I think every oncologist spends hours after our day job, learning more and keeping up to date on all the trials and data and new information there is. And so there's always training in every field of oncology, definitely in breast, where there's so much information out there. I just came back from a seminar in San Diego, 2-day seminar, to again review everything and talk to all the breast oncologists, the real experts nationwide that come together at least once a year, if not more frequently than that, to review and to do more training and literature review, and just to really make sure we're implementing the most advanced cutting edge treatments for our patients.
Well, it seems like a pretty exciting time. I mean, we're on, like you said, the cutting edge of maybe some new things. Do you foresee them to be much more helpful than what we've had in the past?
Yeah, I think the statistics are very much in favor of, we are doing really well in terms of surviving breast cancer. We have a really nice increase in survival rates, and many women are long-term survivors, and that's really our goal. I joke and say my goal is really to be out of a job in the future, and I think we're getting to the point where we're just seeing more and more long-term survivors, and that's really satisfying.
What do you think Breastlink does differently than some other places that people could go to for breast cancer?
Breastlink is a really unique, I kind of call it a very unique center with a heart and soul, and it really has this very personal touch to it. And the feedback we get from our patients is that every step of the way, it's just been such a wonderful experience, from the receptionist to the phone call from the insurance coordinator to the social worker or desk helper to the medical assistant. Every step of the way, I think all our employees understand how stressful it is to be diagnosed with breast cancer, and really a life-changing diagnosis. And so we're there every step of the way, helping the patient work through it, formulating the plan, communicating, and I think that really we're a very unique center in that regard, where we get it, we understand it, and I think patients are very appreciative of that.
That's excellent. In going forward, maybe talking to people about things that they can do to help prevent breast cancer, what would you recommend?
Yeah, I think when I discuss that with my patients, the first thing I always emphasize is that it's never anyone's fault for getting breast cancer. No one is ever at fault. It's never something they did or didn't do, or one thing they ate or didn't eat, or the fact that they haven't exercised in many, many years. It's never one thing. And so we just want to first make sure that there's no, or as much as possible, reduce the amount of guilt, or it's never a patient's fault for getting this. I think there are some modifiable risk factors. We know that all of us usually can do a little better in terms of being healthy, leading a healthy life. And that plays also into breast cancer risk reduction, being as active as possible, exercising every day. I joke with my patients that if I could prescribe one treatment, it would be 60 minutes of good exercise every day. I think exercise has been shown to help patients with almost every aspect of their life, not only with cancer prevention, heart prevention, stroke prevention. It can also help get through treatments more readily. And so all my patients, even during treatment, I encourage them to move and exercise as much as possible. We know that alcohol has now been linked to at least 7 cancers, so we want to minimize alcohol intake. And there's a very nice resource called the American Institute for Cancer Research that tries to go into specifics about how much is too much and how much should we be drinking. In general, the guidelines suggest if we don't drink on a daily basis, not to start, and if we do drink on a kind of frequent basis, we want to probably limit it to 2 alcoholic beverages per week.
Per week?
Yeah.
Okay.
So we know alcohol is good for the heart, but not so good for cancers, and so that's kind of the recommendation I usually give my patients. And then in terms of diet, I usually emphasize a whole food, plant-based diet, trying to stay away from too much animal fat. And again, the American Institute of Cancer Research has a very nice website and a lot of detailed information about that.
And then I would assume also self-checks and
Yeah.
making sure you go to your yearly.
Absolutely.
Right.
Yes.
Those are probably
Yes.
no-brainers, right?
Yes. We also endorse Breastlink mammograms from the age of 40, and
Okay.
there's been some new controversy about what's the right age to start screening mammograms, and
Okay.
we and the American College of Radiology adhere to starting screening mammograms at the age of 40.
Wow. So it has definitely dropped in terms of age.
Well, most recently there was a question of can we push it to 50?
Oh.
And so there's some societies that are endorsing the age of 50, but we're not comfortable yet with that recommendation.
But then 40 isn't necessarily a benchmark either, because
Correct.
there are people who are much younger that end up with breast cancer as well.
Correct, that is right.
Okay, all right. Well, thank you so much for the information. I really appreciate it.
Thank you.
And remember, as with anything, always do your exercise. It can help prevent breast cancer. And then also do your research and do your yearly exams.